Hello, this is Sam again. Welcome back to the channel. Right now is a beautiful day, and what I want to talk about today is about nursing and the future of nursing. And right now it might look beautiful, but soon it's gonna be a perfect storm coming into the healthcare system. I'm sure all of you have heard that, Donald Trump has just signed off on the big, beautiful bill, which in essence, pretty much that's going to create a catastrophic ripple effect on us, on nurses, doctors, everyone involved, and especially the patients. So making cuts to like Medicaid, Medicare will affect a lot of millions of people, and pretty much it's going to affect the healthcare system as a whole. And I guess the best way to describe it, I guess this is more of a warning to a lot of nurses and people in healthcare. That goes for like techs and CNAs, and so one thing is that I'm gonna just break it down. So if you cut Medicaid, a lot of people in the rural areas will lose, they'll lose their insurance. So, and a lot of rural hospitals depend on Medicaid reimbursements to basically uphold their hospitals in the rural areas. These rural hospitals are shut down, which will cause a ripple effect of people coming from rural areas coming to the stronger entities of bigger hospitals within the city. I am one that works at a level 1 trauma center, and the number 1 trauma center in on the southeast of Wisconsin. We have 2 major hospitals within Wisconsin. So I work at one of them, and I happen to work at a med surge. So one of the things that are going to happen is and people aren't seeing this, and that's part of the reason I'm making the video, is kind of to warn people that, they'll, and this is a prediction, take it as a warning sign, as if you can, if you want to. But it's so they'll be making cuts, and it'll probably be hiring freezes, and then there'll probably be layoffs or furloughs to a lot of the healthcare workers. They're going to want to keep the staff that they have to a certain extent until everything implodes. So I'll say they'll probably just start the saying, cut the fat. So you'll probably see more custodian works or maintenance workers getting cut. And then people who are doing minor things the labs, phlebotomists who are drawing blood and things like that, who they'll end up passing those responsibilities to the nurses, because we're supposed to be able to draw blood, do IVs, and things of that nature. So that ended up happening. And then next, they'll probably start doing freezes towards allied workers, like the techs and the CNAs, who they'll either get pay cuts, or they'll just get more work and less pay, less raises, and that'll also fall on the nurses as well. So we'll be overworked. Our ratios are probably going to go up. Right now, ratios where I work is between 4 to 5, sometimes 6, but it'll probably end up being 6, 7, 8, maybe 9. So that'll be a big turn of events, and that'll cause a lot of stress. And then we'll talk about certain specialties. So I would say for nurses who are in med-surg, don't get comfortable, because when it comes down, when they have to hit nursing, they hit the med-surg floors because the level of acuity is not as high in comparison to a specialty like the ER, the ICU, or the OR. So that'll be hit next. So they'll end up, like I said, no raises, hiring freezes, lower staff, higher patient to staff ratios, and so forth. So we'll definitely be stressed out, but my advice to a lot of people is just get you a specialty. Go into a specialty. So like in the ER, for instance, like from federal law, your federal law is required to keep over EDs. With EDs, it'll be a safe place, but and usually people go to the ED because you don't get floated. That's one of the caveats behind working in the ED. It's amazing, because I used to be an ED tech, and I was a tech who never got floated, and it was really nice. But now, you're gonna see, well, if we short staff and we got extra ED nurses, they're gonna go off and be put into a med-surg floor in whatever other specialties they might be able to serve, because it's like, well, you got the skills, you might not be used to the charting, because the charting dynamic is way different on in the ED compared to like a med-surg floor, ICU floor, etc., and like an OR. So you're gonna see that big of a change. So ED, you probably gonna see some changes. So, and then another thing is that hospitals make a lot of money off of your patients being in the ICU. Usually those are people that really have good insurance, but it's not about that. It's not about the money, but it's people who are chronically ill, or they're just like, severely ill, so they're gonna be in the ICU. And once they're in the ICU, these nurses in particular are very high skilled. They got certifications, CCRNs, critical care registered nurses certifications. These people are managing like vasopressors, dopamine drips, neoepinephrine, all different type of like high class drugs. So you have to know what you're doing, and the ratios there are lower. But the thing about ICU nurses, they usually get floated, but they usually get floated to other ICUs, or they can go to med-surgs too, because usually someone starts out from med-surg to go to a specialty. So, I've only been a nurse for a couple of years, so it's like, I'm making a decision right now of like what specialty I want to go into and what's the future in terms of healthcare for myself, because I love it. I really enjoy helping people and being a blessing to to my fellow man and fellow woman, and just helping their days become brighter, and being part of the process of healing. That's always a blessing. So I'm very grateful for my position right now, and so that's another factor. So we're gonna see a lot of things change within the healthcare. Facilities like mental health facilities are going to be closing, and guess what? They're going to be thrown over into these big time hospitals, and we're going to be dealing with a lot of mental health patients and a lot of these mental health patients are going to end up suffering in care because a lot of nurses aren't specialized in psych. We get schooling on it, like psychology and things like that, but for overall, you can get a special certification for that, or if you just work in, like, I think it's like complex intensive care, intensive unit, where you can deal with psych patients, or you just have like a certain psych ward in your hospital that deals with a low volume of psych patients. But overall, we're not certified for that. So yeah, it's gonna be a different world, I say, and we're already starting to see that in the med-surg floors, dealing with a lot of psych patients, people who need are awaiting placement, working with courts and social workers and things like that. And so that's definitely like a big change in healthcare. So we're already seeing it. So it's that's a warning out to a lot of nurses out there. It's not just happening. I'm sure it's already happening other places, and we're already starting to see one of the Mayo clinics got closed down. We're starting to see other hospitals, part of the Aurora entities, getting closed down and stuff like that. Is insane. Like, it's working its way from the outside in, and it's just like, so my advice is like to up your skill set. Make sure that you a vital essence to the work that you're doing. It's probably going to get a little bit more competitive. Another thing that I'm seeing too is within schools, the schools are up in the ante. So basically, they're gatekeeping nursing, and they do this where you heard the term of like degree inflation. So around the time that we go through a recession, we end up having to deal with what do you call it, degree inflation. So basically what used to be a associate's degree is now going to be a bachelor's degree, and what used to be a bachelor's degree is a master's degree. Excuse me. And what used to be master's degree is now a doctor's. So you have specialties like for example, CRNA. CRNA used to be a master's degree, 2 years in school. Now it's a doctor's. And now NP used to be a master's. Now it's required across the United States. I think since 2022, both CRNA and NPs are required to be doctors in all 50 states. And so now, you're dealing with that. And so you got to spend more time in school. That's more money. And then the big beautiful bill, you got cutting in funding. So, oh yeah, that's another thing. Another cut is the Grand Plus loan. If y'all haven't heard, y'all better go read about this. Like, it's crazy. Like, basically what's happening is they're going to cut the Grad Plus loan in July 2026. It'll be gone. They're claiming that they're going to make a professional loan. And so with the Grad Plus loan, the pro was that it wasn't a cap. You could like basically borrow like an absorbent amount of money in terms of like $300K, maybe $400K, and it could pay for the things that you needed for like school and for like you being out of school. So, you're going to be out of school for medical school. You're going to be out of school for 4 years. And then once you become a resident, you're not going to make any more than between $50K to $70K. You make almost equivalent to a nurse at residency. And that takes, depending on your specialty, between 3 to 7 years, or 7, 8, if you're going into surgery and stuff like that. But yeah, and like if you're trying to become a PA, you still might have a chance. If you go in NP school, NP is only specialty that you can actually work as a nurse full time and still go to school full time and become an NP. So that's a possibility, but NP is getting oversaturated, and that's you're going to be competing for a lot more jobs and things like that. So there's oversaturation. And so like CRNA school is pretty expensive too, which that falls within the category of 100K to some 300K. So it just depends. It just depends on where you want to go. PA, MP, medical, like MD, DO, stuff like that. So, you're dealing with this stuff. And like it's a lot to come, so like pay attention to what's going on. It's not all about just being in healthcare. You got to stay up to code to what's changing in healthcare and what the government in itself is connected to healthcare, if we like it or not. So you have to pay attention to those type of things and how it affects you in the long run. So I would say like plan accordingly. I mean, it's pretty much, in my opinion, it's too late for trying to sign up for like a master's degree or anything like that, if it's gonna cost you and if you can't like work during school. I would just wait until they come out with this new professional loan and see what it's going to be all about. I don't know the whole I'll say the whole process and what they're going to do and how they're going to do it. All I know is that there's a cap on it, and that's like 200K. It's like 200K, and that's not enough for you to even go to medical school. Like, it's not even enough. Like, it's just that bad. Like, yeah, so yeah, it's but I'm looking at the bright side of things, just trying to stay positive. And like, I'm blessed to have gotten through nursing school, and that's gonna be and concerning the schools too. So you got schools that are closing down, you got universities, and there's some in Wisconsin that have closed down. Big names too, been around for over 100 years. So like school, it's closing down because of attendance and things like that, and so but yeah, they're gonna be gatekeeping nursing. So people who want to go into nursing, they want to go into healthcare at least, because they know during recessions people go back to school, and that they're going to be rushing towards majors and places that are going to be, majors that are going to produce income for you to survive. And healthcare is one of them. And so they're preparing right now. They're changing the GPA requirements. They're making you take these entry tests, like the T's and all this different stuff, that just create filters. They'll filter you out. If you haven't done community service, they're going to make you do more of that and so forth. So trust me, it's coming. The storm is coming. So if you're not in a nursing program, if you're not in an NP program, you're not in a program that has low barrier entry, then you need to get into it now. Get into it and do what you can, because it's people are trying to survive, and it's just, this is how things are going right now. So excuse me, might sneeze again, but so yeah, sorry for the long video, but I just was like trying to get it all in there and talk about what's going on. And people need to be warned and like educated on what's going on and within the healthcare system, how it is to be a nurse. I just wanted to give the message. So you guys stay cool, stay strong, and subscribe to the channel if you haven't. And talk to you next time.